Hey everyone, my name's Josh. I'm currently a first year medical student at the University of Melbourne, and I'm also one of your Austrek social media ambassadors. So, in this video, I just wanted to address some questions that I've been getting on my personal Instagram page at MD Down Under. It's already pretty incredible how many of you are actually finding my page through Austrek. And I just thought if one pre-med had the question, I'd figure that a lot of others probably do as well. So I just wanted to address some of the most common questions that I've been getting so far. So the first one is just how busy is the course load? So my answer is going to be pretty specific to the University of Melbourne. But first year at Melbourne is pass fail. Yeah, there is a ton of classes. There's about 12 a week. You can get 2 tutorials, which can go up to 2 hours, 2 labs, which can go up to 3 hours each. And we get case studies. We've grouped case study work that we do twice a week for 2 hours as well. But the course is actually very unique. It's very hands-on and very integrated in a lot of group work. So right now we're getting new cases at the beginning of every week, and we get to actually perform lab tests that are relevant to our case in order to kind of come to a diagnosis and a treatment plan, and we work to that for the end of the week with our case groups. So yeah, it's a ton of work, but it's very interesting, very different to undergrad, but it really is engaging and it's really like enjoyable work. So the second question that I've been getting is, have I had time to manage my social life and still see some of Australia while in medical school? And the answer is yes, I have. I'm actually going to be making a blog post about this later this month. But right now, it's just all about really taking a step back, especially at Melbourne. The first year is pass fail. So you kind of need to realize this and realize that, yes, you are coming here to get a degree, presumably your dream degree, because you're moving all the way across the world to get it. But you also need to realize that moving here is also part of an experience. So I have made a ton of time to go see the Brighton beach boxes and I've been to the pier at the St. Kilda Pier. I've been to the beach. I've been to the Victoria Market multiple times, the night market. And later this month, I will be going to the AFL opening game, and I will be doing the Great Ocean Road with a couple friends that are coming to visit. So I would highly recommend making the time to go and travel around Australia while you are studying, because it'll make it a lot more enjoyable. And then the third question I've been getting is it hard to get into medical school in Australia? I have no idea. I don't know the admissions process. Austrek did make it a lot easier, so I just wanted to give a shout out to Kaylee. She made applying significantly easier. And I know personally, if I'm going to be really transparent with all of you, that I have the lowest MCAT score out of all the medical students here from Canada at Melbourne. So I would say just go for it. If you hit the cutoffs, I mean, I got into most of the schools I had applied for with my MCAT, which seemed on the lower end of the cutoffs. So definitely give it a try. You really don't have anything to lose with Austrek. And then my fourth and final question that I'm going to cover is it hard to get residency back home? I'm a first year student, so I'm pretty far from thinking about anything like that. But what I do know is that Australia has 5 of the top 50 medical institutions in the world. And what I've been told from speaking to upper year students is that the States really weighs schools' reputations a lot when making residency decisions and residency placements. And as long as you have a good USMLE score to go with it and you take all the necessary steps, it doesn't seem like there's actually really any issue with students who really want to get back into Canada or the US. But then again, I also really don't know. So you may want to contact Austrek to get some statistics on that. But that's really all I have for you today. So please message Austrek or reach out to me on my personal Instagram page at MDDownUnder with some more questions, and hopefully I'll be able to answer them and help all of you out.